अगर आपके या आपके पेरेंट्स के या आपके ग्रैंड पेरेंट्स के पैरों में स्वेलिंग है विदाउट एनी इंजरी और फॉल, देन today's video is specifically for you. This is something that I get commonly asked in my DMs, or patients come to me saying, yaar, our feet and ankles are always swollen, and not only kuch dinon se but sometimes for many weeks and many months, and they don't know what to do about it. Today's video will tell you why this could be happening to you. आप इसके लिए घर पे क्या ट्राई कर सकते हैं, and when is it serious that you need to visit a doctor. Let's get going. Welcome to the channel. If you're new, please do subscribe. I am Dr. Manan Vora, your friendly orthopedic doctor, and I help you live your life pain-free. I answer the questions that are on your mind and you are not getting easy access to doctors who will patiently sit and answer them for you. This is a problem that is affecting a lot of people, and because it is not an acute problem or not a very serious problem, लोग कई बार इसको lightly लेते हैं and weeks and months just go by. But not anymore. I am here to make sure your quality of life improves and you are pain free, and you should not be having any problem in your day-to-day life at all. Foot and ankle swelling, let's get into the details. सबसे पहले let's talk about the possible causes for your ankle and foot swelling. There are 7 possible causes. One by one we'll go through each of them. सबसे पहले आता है edema, which is fluid retention. Now edema happens when there is extra fluid build up in the body. How do you identify this? आपके फुट या एंकल को प्रेस कीजिए और अगर आपको एक डेंट दिखेगा, this is a sign of fluid retention. Now this could be possible अगर आप बहुत टाइम के लिए बैठते हो या बहुत टाइम के लिए खड़े रहते हो, or you could be having a systemic disease like hypertension that you are not aware of, or it could be a consequence of certain medication that you are taking. Second one is sodium potassium pump dysfunction. हमारे बॉडी को जरूरत है an ideal balance between sodium and potassium to manage the fluid levels. Now, if there is a dysfunction in this balance, then water will get collected in tissues where it's not supposed to get collected. Just imagine this as a water pump. अगर water pump टूट जाएगा, तो of course water collection will happen in an area where it actually shouldn't. This usually happens in the feet and ankles, and that is why the swelling occurs. The third point is high blood sugar levels or hyperglycemia. अगर आपका शुगर बढ़ गया है और आप ये बात जानते ही नहीं है, and your feet and ankle are swollen, this could be one of the reasons. Or you could be having diabetes, you know it, you are on diabetic medication, but your blood sugar is not being controlled. There is a chance that you can have swollen feet and swollen ankle. अब ये क्यों होता है? When your sugar levels are high, your blood flow gets affected, leading to pooling in the legs and in the feet and the ankles, and this causes uncomfortable swelling. Fourth point is sodium retention linked to sugar consumption. अगर आप sugary food ज्यादा खाओगे, your body will hold on to more sodium. What does sodium do? Sodium attracts more water, and this leads to overall more fluid buildup in the body, and this goes and settles down in the tissues of the periphery, which are your legs, feet and ankle, resulting in all the swelling. The fifth point is vitamin and mineral deficiencies. Now there are a certain number of vitamins and minerals which play a crucial role in fluid balance. और अगर आपको इनमें से किसी की भी डेफिशिएंसी है, तो वो फ्लूइड बैलेंस डिस्टर्ब होता है और फ्लूइड बिल्डअप होता है और आपको स्वेलिंग होता है. Now, which are these vitamins and minerals? Number one is vitamin B1, which is thiamine. The next is potassium, and the last one is magnesium. So you may need to increase your intake of these vitamins and minerals, and if you are deficient, you may even need to consider supplements. The sixth point is peripheral neuropathy. Very commonly seen in diabetic patients. Your nerve endings of the feet get damaged. Because of this, आपको पैरों में numbness होती है और swelling भी होती है. And the last and seventh possible cause is eating refined carbs and excessive sugar. अगर आपका डाइट बहुत ही खराब है, अगर आप ज्यादा रिफाइंड कार्ब्स खाते हो, आप बहुत ही शुगर खाते हो, your blood sugar levels will increase. Now, when your blood sugar levels increase, this makes it very difficult for your body to handle potassium and magnesium, resulting in a derangement or imbalance in fluid levels, which leads to fluid retention, which leads to swelling of your legs, feet and ankles. ये थे सारे causes which could be possible and the reason for you having this feet and ankle swelling. Next time someone tells you थोड़ा swelling ही तो है, इसमें बड़ी बात क्या है? नहीं, उनको ये वीडियो भेजो, उनको बोलो Dr. Manan has explained 7 different possible causes and I could be having any one of them and I want to get myself checked and treated. अभी आप बोलोगे Dr. Manan, you have given us all these different causes. Please tell us what we can do about it. So don't worry, I am here just for you. I'm going to give you 10 tips now that you can incorporate right away to help reduce the swelling. The first one is cold compress. Apply cold packs या फिर ice for 15 to 20 minutes on your feet and ankles जिधर भी swelling है 2 to 3 times per day. This will help reduce the inflammation and provide some relief. Number 2, include potassium rich foods in your diet. आपको खाना है bananas, avocados, spinach. This will improve the potassium sodium balance in your body and keep that fluid retention away. Number 3, keep your magnesium levels in check. आपको दिन का 420 milligrams of magnesium खाना है. आप कहां से खाओगे? Almonds, pumpkin seeds, chia seeds, black beans, whole grains. You can consume all these to improve your magnesium levels or consider magnesium supplements. Very important to regulate your fluid level. Fourth point is विटामिन B1 सप्लीमेंटेशन. आपको थायमीन चाहिए आपके डाइट में जो आपको मिलेगा होल ग्रेन्स और नट्स से. Reducing refined sugars is also very important. Fifth point is stay hydrated. आपको दिन का 2 से 3 लीटर पानी पीना है without fail. Only if your water intake is high will your body flush out the excess sodium and thus removing all the swelling from your feet and ankles. Number 6, elevate your feet. Whenever you are sitting, try and extend your legs. Keep your feet on a pillow or cushion. जब आप रात को सोते हो, put 2 pillows and keep your feet at a level of 6 inches above the heart. This promotes drainage of fluid. Number 7, gentle exercise. Try low impact activities like walking or swimming or even simple basic foot and ankle exercises to help boost circulation. If you want me to make an entirely different video on what foot and ankle exercises you should do to help reduce the swelling, comment exercise in the comment section below. Number 8, manage your salt intake. You can try and add more herbs and spices and try and reduce the amount of salt and sodium you're consuming. Number 9, avoid prolonged sitting or standing. Whenever you are in one position for very long, peripheral pooling of the fluid can take place, causing that swelling. So please make sure you take frequent breaks and stretch and move around a little bit more. Number 10, monitor your blood sugar levels regularly. Please remember, if you are having swelling in your legs, feet and ankles, you are at a higher risk of some issue or the other. Please monitor your blood sugar levels. If you keep your blood sugar levels in control, you have a higher chance of getting rid of that swelling. Ensure you are consuming a balanced diet with very little refined sugar. And there you have it. You have 10 tips that you can try out to help reduce the swelling and get rid of it. However, in certain cases, you may need medical intervention. आपको डॉक्टर के पास जाने की जरूरत पड़ सकती है to get investigated further so that you can be put on a proper treatment plan. Let's discuss those warning signs or red flags that you need to keep in mind. If that is happening to you, go get checked. सबसे पहले आपका medical history. If you have a history of heart failure, kidney issues, blood clots, and you have persistent ankle and foot swelling, go get checked. Second, if your swelling is accompanied with redness, warmth, or pain or tenderness, please go get checked. This could be deep vein thrombosis or any other infection and it deserves an evaluation. Third, आपकी पैरों की swelling दोनों पैरों में नहीं है, सिर्फ एक में है. That is something that needs investigation. So please go get checked. Fourth, अगर swelling के साथ you are experiencing a lot of numbness and you are not able to move your feet and ankle normally, it's time to get checked as well. Fifth, you have been started on some new medication और इसके side effect या consequence से आपको foot and ankle swelling हुआ है, please go back to your original doctor and discuss this with them so your medications can be changed. And sixth, persistent swelling. You have tried all the 10 tips that I have given you, but still the swelling remains. Please go get checked so it can be evaluated. And that's it. Understanding foot and ankle swelling is very difficult, lekin I hope I have managed to make it little easier for you. I have told you what are the things that you need to look out for, ye aapko kyun ho sakta hai, and when is it serious enough to go get checked. Please do not neglect it as हाँ यार थोड़ा सूजन तो ठीक है, थोड़ा सूजन भी ठीक नहीं है, and it is important for you to look after yourself and your loved ones, because I know a lot of people watching this will not have this swelling themselves, लेकिन उनके parents या उनके grandparents को ये हो सकता है. And please take this video to them, show it to them, and let them also understand that they need to seek some help. Please do hit the like button, drop a comment, and do subscribe to the channel. आपको ये करने में 1 ही second लगेगा, लेकिन it shows your appreciation for the effort I am taking and makes me more motivated to give you all this high value information right in front of you on your screens. Thank you so much for joining me for this video, and I'll see you in the next one.